Welcome to the Love and Guts podcast, Raul. I love
Thank you
saying your
for
name.
having me. It's a pleasure.
I'm so excited to get into this topic. I feel like it's a conversation that needs to be had. But before we dive into it, can I just read your bio to people that may not be familiar with who you are?
Of course.
And if I'm looking up there, guys, it's because I've got all my questions and everything up there. So yeah, I'm just not looking into space. There is a method to the madness. So Raul Pastrana is a degree qualified naturopath specializing in fertility and reproductive health with a particular focus on male fertility, an area that's often overlooked in the fertility conversation. He works closely with individuals and couples through preconception care, IVF preparation, and natural conception, creating tailored treatment plans based on semen analysis, blood pathology, and each person's unique circumstances. Raul is the author of The Male Factor: Fertility is a Shared Responsibility, where he explores how men can actively influence fertility outcomes and provides practical strategies to improve sperm health. Drawing on his background as both a naturopath and a personal trainer, Raul has a gift for translating complex health information into actionable changes that people can actually integrate into their daily lives. So, in today's conversation, we're diving into why male fertility matters more than most people realize, not just for conception, but for pregnancy outcomes and even the long term health of children. So, let's get started. How exciting!
Well,
um, how'd you find yourself specializing in the space of reproductive health?
um, I had a talk with one of my mentors in the clinic in the university clinic when you do your practice, and she asked me the same question. And I think that it's a field that is evolving very rapidly, and I really like that. I think as naturopaths we can make a huge difference to preconception care and reproductive health outcomes, and I thought, let's do it. And obviously, then I met Rhiannon Hardingham, who now is my boss and mentor
Yeah.
where I work at RH Reproductive Health. And since then, it's just been an easy path.
Oh, of course. I've done quite a few modules of Rhiannon. So you're very blessed to be in that space. And I'm sure they're very blessed to have you as well. I think I even saw one of your webinars that you did
Yeah, yeah, we did
with
one.
oh, forget that name. It was a
Uh,
combined one.
Natalie.
That's right. Yes.
Yeah.
Forgive me, Natalie. But awesome. So, male factors contribute to at least 50% of infertility cases, yet the woman often carries the burden of investigation and treatment. Can you paint a picture of what this actually looks like in practice, like what couples experience when they come to you?
Well, what it looks like in practice is you get a couple, in most of the cases in our circumstances, that they've been trying to conceive for a number of months, if not years. And in many of those instances, they have tried a number of procedures, like they might have done egg retrieval, might done semen retrieval, they might have a few embryos already frozen, and they might have tried a couple of transfers and they haven't worked. That is usually the situation that I see patients presenting with. They might have tried a lot of things and nothing has worked. And our job is to look at everything a bit holistically and understanding where is the barrier for conception. And the problem that I was seeing over and over in practice is that the female counterpart was coming to the appointments with
Yeah.
several tests, multiple blood pathology, ultrasounds. Um, she has done egg retrieval. She she has done everything that is on her power to optimize those fertility outcomes. And then when I asked for the semen analysis, hasn't been done, was incomplete, or was told that everything was fine when actually it wasn't.
Mm.
And that's what prompted me to write the book and really get into the nitty-gritty of sperm health because I think that, like in the book says, fertility needs to be a shared responsibility. It's completely unfair that those assigned female at birth are carrying all the weight of
Mm.
responsibility when it comes to these huge, challenging fertility journeys, and the male counterpart is not bring to the equation because no one is telling them either. Like they're not telling
Yeah.
them, hey, your sperm really matters for this embryo quality and for all these pregnancy outcomes. So I feel that if they will know how important is that raw material, there will be different outcomes.
So, in your experience throughout the years, has that changed? Has there been a bit more knowledge around it? And is it more a case of the woman comes in for her consultation, is doing all the things to improve her fertility, trying to fall pregnant, and it's one of the last things they look at when things just aren't happening for them? And let's look at the partner now, for in her mind, versus, if you they walk into a clinic like you guys
Mhm.
going to address that straight away? Is it just lack of knowledge, or is it that, okay, well, the women just tend to follow up on these things anyways, and their partners are resistant, or they themselves aren't knowledgeable around it? Does that make sense?
Yeah, so I feel that it has changed in the last 3 to 4 years. So before, in many cases, there was no semen analysis at all. So we are moving in the right direction, but we're not there yet. We are not in
Yeah.
equal. The equation is not equal. Now, what I'm seeing a lot of is, okay, the semen analysis was performed, and I was told that everything is fine and there is nothing I need to do. Or the other most common scenario that I see is the sperm health is not great, so therefore I need to do IVF.
Yeah.
Because I think there is this myth, this misunderstanding that sperm health is very static and there is nothing you can do to improve your outcomes.
Yeah.
Sperm health is changing all the time. You can make it
Yeah.
worse or you can make it better. If you prioritize your health, your sleep, your nutrition, you address your nutritional deficiencies, you ensure that your gut health is working well, that you are not overheating your testicles, all those factors are going to contribute to better sperm health in the coming months. So if for whatever reason, let's say that, for example, morphology is at 2%, that doesn't have to be like that in 6 months' time if you do the
Yeah.
work.
Which is so powerful to know. And I know that we're going to get into that a little bit further on down the track, what influences sperm health in depth, and also what people can do, knowing that it has this ability to change, and they've got lots of influence around that prior to starting something like IVF. So most people think male fertility is just about whether or not you get pregnant, but sperm health actually affects so much more than that, like things like miscarriage, pregnancy complications, and even the baby's long-term health. Can you explain how sperm quality influences all of these outcomes?
Yeah, I'm going to use a study that was published last year to explain this. The study was named When Does Sperm Impact Fertilization Success? And the study was analyzing the incidence of sperm-related poor fertilization in ICSI, um, in matched oocyte donation cycles. So basically, they did lots of retrieval of sperm, there were lots of donors of egg donation, and there were 13,600 donor oocytes, and they understood, they analyzed when there was poor fertilization rate. Um, the poor fertilization was less than 30, when fertilization happened on less than 30% of the instances, okay?
Mm.
And that only happened around the 3%. So most of the time fertilization happens.
Yeah.
But when fertilization doesn't happen in those 3%, why it doesn't happen? Is it because of egg quality or is it because of sperm quality? And I think it's important this study is very important because in 84% of the cases when fertilization didn't occur, it was related with the sperm health, not with egg quality. So
That's
this
crazy.
shows
Yeah.
how important sperm
Mm.
health is. Is it more important than egg health? I don't think so. It is a bit, it is a very black and white answer. I think both are equally important, and we just can't leave um, any any room for issues when we're not testing that sperm. So when
Mm.
the studies are saying 84% of the cases are linked with sperm-related factors, we really need to do our best to improve sperm health.
And I really want that to land for people, because for those of us that have experienced a loss, including myself, we immediately go to, I'm broken. What have I done to contribute to this? Or is it just, and something that's naturally, that was always going to occur? Like there's just this then further investigation of the female. And so knowing those stats, I think, is so important, because those sorts of things like pregnancy loss can be so devastating for
Mhm.
us. And so wouldn't we want to give it a fighting chance by, okay, if we're going to do this, let's really set up the foundation well by looking at both partners who are involved in the conception, and just making sure that we're at optimal health. We've got nothing to lose. If anything, you're just going to be at your optimal health, and what's wrong with that? But yeah, those stats are really important to really have land with us, I think, because it is overlooked. I mean, I was guilty of doing that in 2018, 2019. I was like, oh, didn't even consider the quality of my husband's sperm and its impact on the loss, potentially may or may not have influenced it. We obviously did the testing and that on the sperm, but I didn't even consider it as a potential player in that loss.
Mhm.
Um, yeah, so it's just, I think a lot of us will kind of, that's going to really hit home for a lot of people. So we mentioned briefly that men actually do have a bit of influence, quite a bit of influence on the quality of their sperm. They're constantly making sperm every 72 to 74 days, which means lifestyle changes have a pretty quick impact. What can actually be improved in that sort of time frame?
Yeah, think about the pillars of health, the most important things that you do in your daily life. That is sleep. How are you sleeping? Are you prioritizing to get, a good amount of sleep? And I don't like to say 7 or 8 hours for every person because some people do better at 6, some people need 9. So whatever do your body needs in order to function well, that is what you need to prioritize. But definitely having a sleep that is deep enough where you're not waking up multiple times during the night, um, going to bed around the same time, waking up around the same time. It's so simple.
Mm.
um, Things like nutrition, making sure that your gut health is working well. Something that I'm seeing more and more in practice lately is the effect that gut health and poor gut health has in sperm and testicular function. So if you are constantly bloated, if you are burping all the time, if there is lot of gas happening, that is going to have a huge influence in your level of inflammation in having that so-called low-grade inflammation in your body that is going to have a repercussion in your testicular function and sperm health.
Mm.
Checking things like hormonal balance. Are you producing enough testosterone? Because testosterone level is very important for maturation of the sperm. Sperm starts being synthesized by the effect of FSH, but after a few days, after a few weeks, it's the job of the testosterone to keep maturing that sperm, and without enough testosterone, the sperm can be immature. Making sure that there is no nutritional deficiencies like zinc, selenium, iodine. So I think it's important to do a comprehensive blood test with all our patients because what I say to my patients is, okay, the semen analysis tells us whether or not you have good sperm or if a sperm health needs to be improved. The blood test, good blood test assessment, tells us what pillars or what factors are implicated in your poor sperm health.
Mm.
And where do we need to tweak? What do we need to change in order for that sperm health to improve?
And when you're what sort of blood parameters are you looking at? You've mentioned a few, but what would be
Yeah,
main things you're looking at when you're
a
doing a workup?
full hormonal panel with
Yep.
FSH, LH, testosterone, estrogen, prolactin. Very important. Free testosterone with SHBG as well. Hyperprolactinemia is very common, much more common than we think. Um, and it can really affect um, testosterone levels and testicular health. Um, it's very common in high levels of stress to develop high levels of prolactin, so this is something to keep in mind.
Okay.
So all those that I mentioned. From a blood glucose perspective, is also something that I'm seeing very commonly in practice is how dysglycemia or blood glucose dysregulation um, is affecting sperm health. And that's because if your blood glucose is going up and down, and then you're having a huge sugary meal, and it's going really high, then it's going really low, lots of insulin levels. that's going to have a huge effect on your inflammatory profile and how inflamed you are. So I like to test for fasting glucose, fasting insulin, and HbA1c.
Yeah.
The triglyceride levels and the lipid profile also give me a lot of clues to whether or not your carbohydrate intake is too much.
Mm.
So then I can draw some conclusions to give advice into my specific advice for nutrition.
So there's a couple of other areas I'm thinking of when I think of what could potentially negatively or positively influence testosterone, and I'd love you to shed some light on it, bust some myths maybe. Um, so what's your thoughts on things like light therapy, and also so natural light therapy, like getting enough light exposure throughout the day, supporting circadian rhythms that way, but also sauna use and that, like, are there any sort of caveats around that? Can people still use a sauna, for example, or is it a straight no
Yeah,
temperature
straight,
changes? Yeah.
straight no,
Yep.
straight no.
Natural sunlight, though, of course, getting that exposure, supporting circadian rhythms.
So let's start with the sauna. The sauna on the 3 months prior conception, my answer will be no sauna. Other than that, yes, sauna can be beneficial. There is studies that prove how, for long-term health, 50 minutes of sauna per week is the ideal time. So maybe to go into the sauna twice per week, around 25 minutes, can be ideal for long-term health. However, when we're talking about sperm health, we don't want to overheat our testicles. Our
Mm.
testicles are in our scrotum, and that's hanging out outside of our body because they
Yeah.
need 2 degrees less than body core temperature in order to produce optimal level of testosterone, spermatogenesis, etc. So if we are overheating them, we are disrupting those mechanisms.
Yeah.
And in other words, excessive heat in the testicular area is going to damage the sperm. So I will say if you're trying to conceive, try to avoid
Yeah.
saunas
Absolutely.
in those 3 months. What you were just mentioning about sunlight exposure, I think for everyone, you need to get out on
Yes.
the sun.
Yes.
It is not normal
Get
to
out of the
be,
sun or into the sun.
no, get into the
Oh, I
sun.
was about to say, oh my God, no.
No, no, no.
I just did a
Um,
podcast recently on the importance of light therapy on the microbiome, even. And I'm like, that's just really so important that we get enough sun exposure safely, throughout the day and even to support that sort of circadian rhythms, all of the circadian rhythms in our body, which there are many, you know. Yeah.
I just can't think of one area of your health that wouldn't benefit from optimal sunlight exposure. So obviously, if
Yeah.
it's 35 degrees outside and it's the middle of the day, you might want to limit, make sure that you wear a cap and sunscreen and all those things. But every aspect of your health, your mood, your hormones, your testicular function, or your ovarian function, if you are a female, everything is going to be benefited from you being exposed to the sun. Being outdoors is extremely important. So. Yeah.
And you've got a past history in personal training.
Yeah.
What's your thoughts around the impact of weight training on testosterone levels? Where
Mm.
do you sit with all of that?
I will say that I have dedicated quite a big chunk of the book to explain all these.
Great.
Yeah, so I'm gonna go over with you now, but for anyone interested in what's the effect of resistance training, how bulking or cutting in the gym, which are the phases by which people either focus on muscle gain or fat reduction, can influence also testosterone and sperm synthesis. I go in much more detail into them, but resistance training for any human being is super essential.
Yeah.
We need to expose our muscles to some form of load in order to keep them healthy, in order to keep them stimulated so they don't atrophy. And what we have been discovered over the last few years, thanks to lots of scientific studies, is that muscle is not just to move our bodies. It actually has
Yeah.
a lot of endocrine function.
Yes.
It gives something that I like to call metabolic flexibility. So let's say that you have two people, and the two people weigh exactly the same, but one of them has more fat, the other one has a bit more muscle. They have the same, more or less, stats. If you feed a sugary meal like a donut or a cookie, something like that, to both of these people, the person that is carrying more fat, the cookie or the donut is going to be feeding the fat.
Mm.
If you give the same meal to the person that carries a bit more muscle, the donut is going to replenish the glycogen stores of the muscle.
Mm.
So when you have a bit more muscle, because you're doing resistance training and you're stimulating your muscles weekly, you have the capacity to allow yourself to have a bit more of a treat, go out for a meal, and not having such a huge effect on your blood glucose and in your
Yeah.
health. So, from many, and this is just one of the reasons why resistance training is so important, but um, for my male patients that they're trying to conceive, I always ask them to start some form of physical activity if they haven't already.
So important. And I think even, yes, so important for everyone, but for those of us over 40, women and men,
Hmm.
men experiencing andropause and women perimenopause, menopause, all the, after 40, all of us ladies would really benefit from that strength training, from a lot of weight training for a lot of the reasons that you've mentioned, that blood glucose support, everything, metabolic flexibility. So, yeah, we're talking about sperm health here and testosterone, but it's just super important. I need the constant reminders because my go to that I enjoy things like Pilates and things that don't, I'm not necessarily lifting heavy weights. But my husband, who's also a person who is an ex-personal trainer, is always on me about lifting weights, lifting weights, lifting weights. You've got to lift weights, come on. And every time I do it, I do feel good and I kind of feel my body responding so well to it. But
Mm.
yeah, it's just, I like having these conversations just more so to remind myself as well. The
Well, keep in
importance.
mind that when you're doing Pilates, there is resistance because you
Yes.
have the
So we
strings.
don't need to go too hard, or can we? Because I don't feel like like I'm not really lift. Like, how much do we need to lift in order for it to be substantial enough to work that
Mm,
metabolic flexibility?
well, it depends from person to person. I always like to give very individualized advice because if I tell
Of
someone that
course.
hasn't done any form of physical activity whatsoever in the last year to start going to the gym 3 times a week, doing 2 runs and one yoga, that person's stress level
Yeah.
from a physical
Or they just won't come back.
standpoint, it's just, first of all, you're going to lose the patient.
Yeah. Yeah.
And second, the way in which the body is going to react is by increasing the cortisol radically. So it's
Mm.
important to start slow and build up. So, for example, if you're doing, I'm just gonna use your example. You might be doing 3 Pilates sessions per week. Is that better than doing none? Obviously. Could you maybe do 2 Pilates session and 2 resistance training, and would that be better? Absolutely. But
Yeah.
you have to meet people where they are as well. We cannot aim for perfect exercise routine or perfect prescriptions or dietary patterns for our patients because that's never going to happen. So I think it's
Absolutely.
important to meet them where they are and give them a little bit of advice into what you think is going to be making the most difference.
It's interesting. I think in the early days of practicing, many moons ago, I would have probably been a bit more strict, a bit more hardcore with my recommendations,
Yeah.
because I was quite disciplined and rigid. And I think now being a mum and knowing that time is so like sparse that getting exercise in is just anything that's going to support my mental health is great. And I never thought I'd be in that position. So I can really appreciate those that are time poor, that maybe solo parenting, that maybe it's just not possible. Maybe they don't have the funds to join up to a gym or have a membership of some sort, and they're having to encourage themselves to do this exercise themselves. And so I kind of can really appreciate meeting people with where they're at, because that's where I'm at the moment. So really important. So let's talk about DNA fragmentation. It's
Let's.
so often overlooked in standard fertility workup. So what do couples miss out on when this isn't tested? And have you seen a change when it's addressed? So first of all, let's start with what is DNA fragmentation for those that might be like, what on earth? How do I even ask for this? Is it routine? Is it going to cost me anything to get done?
Yeah, it definitely will.
Yeah, sadly, but
Very few
people
things
are
are for free.
expecting to pay when they're doing fertility.
Yeah. So this
Stuff.
the common semen analysis that we all know or everyone should know about is you test your sperm concentration, so how many million sperm per milliliter, the progressive motility and the total motility, and the morphology. That's the most common parameters assessed in a semen analysis. But what I like to call that is an incomplete semen analysis because you are not covering DNA fragmentation. And the information that this parameter tells us is what percentage or how much DNA inside of the head of the sperm is fragmented and therefore not ideal for conception.
Mm.
So if you think about the image or the typical and the stereotypical image of the sperm with the tail and the head at the
Yeah.
front, inside of the head, it is the nucleus of the sperm. Inside of that nucleus, there are 20, or there should be 23 chromosomes. And that will contribute to the 23 pair of chromosomes for the future of the health of the child with the 23 of the mother of the egg. Those 23 chromosomes need to be unfragmented, intact, in order to produce a viable embryo that will have the capacity for placentation and be given a live birth. This test, DNA fragmentation, tells us how fragmented that DNA inside of the head of the sperm is. And what we know is that um, anything above 10 really reduces the chances of having a successful IVF or natural conception. Um, Ideally, we want our patients below 5, below 10, but it's a case-to-case scenario. For example, I just finished a conversation with one of my patients, and at the moment, when he first started, he was on a DNA fragmentation of 40. We have done a lot of work. We have solved some of his issues, and now the DNA fragmentation is at 25.
Amazing.
It's not where we want it to be, but I said to
But
him, this has
it's definitely moving
happened.
in the right direction.
Yeah.
Um,
This has happened in 3 months. Let's
mm,
work another 3 months and see if we can bring this 25 to maybe 15, and then you can consider IVF or natural conception. We will see when we get there. Um, but it is a very important thing to get assessed and treated if needed.
mm,
Because if you think about the female counterpart, how much effort goes into get those egg in a steam cycle to get those egg the retrieval of those eggs. You have
yeah.
to use drugs, you have to go to so many medical appointments, you have to raise your estrogen levels dramatically. It's a stress in the body.
Yeah. That
So,
mental load is huge.
yeah, you want that the sperm that is going to be fertilizing those embryos to be optimal. So it's good to get that test.
Mm. And how much does it cost generally to get DNA fragmentation?
On the top of my head, when I send my patients for full semen analysis, including DNA fragmentation, I think the cheapest is around $350 here in Victoria.
Yep.
I think it's pretty similar all worldwide in Australia. Some clinics can cost around 550, so it's good to see which one is a bit more cost effective.
Yeah.
Um,
Especially
and
if you're going to be doing repeat testing.
yeah, which in many cases is necessary. But what I would say to anyone listening, thinking, oh, maybe I can get a Medicare rebate for this. I think it's like $30 or $40 that you get back. So it's just better to pay out of pocket
Mm,
because going to the doctor will cost you $50. So it's not really worthwhile
yeah.
for most people to get that referral from a doctor. You're still gonna have to pay.
They're just absolutely invaluable. And the money that you probably would save by doing the DNA fragmentation and getting that data is
Hmm.
huge. And you can then actively take those steps to change that
Absolutely.
presentation. So we've already spoken about the blood markers, which I think is really important to run through, the semen analysis. What does a healthy seminal microbiome look like versus a dysbiotic one? And what are the most common pathogenic organisms you see affecting sperm quality? It's something that's probably spoke about just over the last couple of years, that seminal microbiome. What's your knowledge around it and what do you see? Do you have some insight?
It's an area that is rapidly growing, but we already have some knowledge into what should it look like. Should be Lactobacillus dominant
Yeah.
mostly. It needs to have a pH from 7.2 to 8, but ideally what I like to see in my patients is a 7.4 to 7.8. I think that is the optimal range. When the pH of the semen is lower than 7.2, it can suggest things like seminal vesicle obstruction, or there is no contribution from the vesicle at all. When the pH is higher than 8, it's commonly associated with infection. So it might be an STI or any other form of infection that needs to be treated. When the microbiome is not ideal and there are bacteria there present that they should not be there, or bacteria there present that there should not be so many of them there, that creates inflammation, oxidization, and again, it's going to damage the sperm. Um, so it is not something that I test as much. Um, but when I have considered, okay, it looks like that there is some sort of inflammation at the testicular area and we don't know where it's coming from. Let's have a look at your seminal microbiome. Um, what I will say is that it is not, it doesn't, the seminal microbiome is not isolated from the rest of the body. So it's important to also consider the gut microbiome, which is our
Yes.
most important microbiome. Um, and in many cases, to treat one, you need to treat both. But we use in clinic things like sprays, liquid herbs that can be taken orally, probiotics, and all that helps us to positively influence the seminal microbiome. Um, in many cases, the seminal microbiome will be affected also the vaginal microbiome of the female counterpart, and therefore need to
Yes.
be treated at the same time. Common infections that we can find there that they are not just STI are like Prevotella, Atopobium, Gardnerella, and those can be identified in the test. Yeah.
And so you did mention the gut microbiome there. So can bacteria, for those that may not be familiar, can bacteria or bacterial metabolites actually translocate from the gut to the reproductive tract? And what's that mechanism there? And what does that research tell us?
It can definitely. So if you have low lacto in what we see, and there is more information about vaginal microbiome in this case
There sure
than
is.
um, in the seminal microbiome. But what we know is that it can translocate. For example, if you have low lactobacillus, um, uh, low lactobacillus gut microbiome with high levels of hydrogen sulfide producing bacteria, with high levels of hexa-LPase producing bacteria, you know that that's going to have an influence on the overall environment um, of the individual inflammatory
Mm,
profile. That's going to
yes.
have an effect on the lactobacillus in the vaginal or in the penile region, and therefore the chances of getting an infection are much higher because I think something important to say is the penile microbiome and the vaginal microbiome need to be lactobacillus dominant.
Dominated, yes.
Why?
And not
Because
as
they,
diverse as you would want to have in a gut environment. We're looking for a bit more of a lack of diversity or dominated by only a few species.
yeah, and it is protective. And why is that lactobacillus dominant protective? Because those lactobacillus can create lactic acid. And
Mm.
the lactic, especially in the vaginal environment, and that lactic acid in the vaginal environment protects against infection because creates a more acidic pH.
Yeah.
Without enough lactic acid and without enough acidic pH, the chances of one of these bacteria, Prevotella, Atopobium, to colonize the region are much higher.
Yeah, absolutely. And it kind of makes sense that sort of when we're speaking about the gut and the reproductive tract and that sort of translocation potentially, but that connection is well established that clinically men with things like inflammatory bowel disease, IBS, and other gut conditions often have reduced fertility. So it's important then that we are looking at the gut microbiome and the state of the gut environment, as well as everything else that you've spoken about. Um, but yeah, interesting. I just think that there's probably a little bit more information on the vaginal microbiome, probably only one of the only areas that there's more information on the females versus the males when you think of all the clinical studies that are out there.
Thank God,
Yeah,
one at least.
yeah. um, so I'd love for you now to talk about like the main factors that influence sperm health. You've mentioned a few, and specifically love for you to dive into the things like medications, alcohol, and some of the antibiotics and some of the lesser known culprits that can have a negative impact on that.
Hmm. Let's just step a step back and restate how sensitive is the testicular environment. It's a very
Yeah.
sensitive area in the sense that it can be disrupted by so many things, right? So we need to, when we are assessing our patients, it is important for us to ask all the questions. Like, for example, are you taking any medication? No. Are you sure you're not taking any medication or you
Yeah.
haven't taken any medication in the last 6 months? Something that you've been, reaching for, whether it is having benzodiazepine for sleep or a anti-inflammatory because your knee was hurting. And sometimes they say, oh yeah, actually, 2 months ago I was taking anti-inflammatories for like 6 weeks. And then you did the semen analysis like 2 weeks later, but you didn't thought that the anti-inflammatory that you were taking could have an effect on sperm health. And we know that from studies conducted recently, this one also came last year, and I have it here in front of me because I want to talk about it. So this one was this is a 2025 paper that study males that use ibuprofen for more than 60 days at any given year.
Mm.
And what they found out is that they had a double incident risk of having an infertility diagnosis. We're talking in 365 days, those that took an ibuprofen for 60 days or more
Yeah.
had a
Happened a lot for a lot of
double
people.
double the risk of having that infertility. That is huge.
Yeah. Yeah.
That just shows the effect of these medications in testicular function. So it's important to take note of that. Are you also taking something like um,
Antidepressants.
antidepressants? Huge as
Mm.
well. Finasteride or any of these 5-alpha reductase inhibitors that now many males are taking for hair loss prevention. We know that that has an effect on testicular function. And I don't think my job is to ask anyone to stop taking their medication. That's out of the scope of my practice. I need to refer them back to their doctor. But once we know that this could have an effect on your fertility outcomes, then we can say, okay, maybe talk to your doctor and they can change the medication or they can bring the dose down, or always under the doctor's supervision. But then you can do something about it when you have that information.
And you've got a personal, like a clinic experience with someone taking the can't say it. Is that correct?
Finasteride.
That's the one. Yeah. You had a personal experience with someone taking that in clinic and you were able to, with the collaboration with their GP, able to get that dose down. Did you want to share that?
So this
Have
one
I got that
was
correct?
the I have had with finasteride and with SSRIs. With
Mm.
finasteride, it has happened a couple times where I have mentioned to the patient, "You're taking this medication. Do you know that this can have an effect on your testicular function and that the semen parameters that have come as poor could be related with this medication? Has anyone told you this?" And they, in most cases, they tell me no. And they say, well, talk to your doctor. And if he's okay with you, you can consider, with your doctor's approval, to change the medication or give it a break for 3 months. So then we can work on your sperm health once, um, once conception is achieved and there is the live birth, you can like go back to your medication. So that has happened a couple of times. But the one that happens very often is with antidepressants, with SSRIs.
Yeah.
And I can give you examples like one of my patients was taking 150 grams of, which one was it? It was an SSRI. sertraline. He was taking, it was sertraline, I can't remember now, but it was 150 milligrams. And then we work on his neurotransmitters, nutritional deficiencies, and in conjunction with his doctor, we were able to reduce the dose to 100 and then further to 50. And then we did a bit more work with in other areas like sleep, gut, etc. And then we retest. The semen was it looked like someone else's semen. It
Yeah.
was incredible the effect that this medication was having in morphology, motility, and DNA frag. It was crazy. Um, I was surprised myself. I didn't know that we were gonna get such a positive result. It was incredible.
But isn't that great for people to hear that that's possible? You know, may not be for everyone, but that is possible, that it has, once you change certain things in lifestyle, medications, you know, diet, the huge impact that you could have on something like this. It's just,
Mhm.
it's possible. You might as well give it a try, you know. Um, what about alcohol, antibiotics as well?
Um, let's start with alcohol. Alcohol is for me a very simple, straight answer. How much can I drink? Raul, how much can I drink?
Yeah.
It's up to you. I'm gonna give you the information. The less you drink, the better.
Yeah.
No drink is better than one drink a week.
Yeah.
One drink a week is better than two, and so forth. So I give you the information. I think it's very fair to ask to any male that is trying to conceive to reduce as much as possible alcohol consumption, if not avoid it completely for 3 months. It's only 3 months.
Yeah.
It's not that big of a commitment. And the effect that
For
that can
some.
have.
Like
Yeah,
when someone's very much reliant on it as a crutch, or you know, like it may feel like, for you and I who work in the space of the gut microbiome and fertility, that you're like, well, just if you can eliminate it altogether, perfect. But you know, for some it may not be that easy, right? So like you said, you know, sort of reduce by this amount per week, or try not to go over that amount per week. And you know, it's for some it might feel very bigger than Ben Hur, coming reducing their alcohol intake or coming off it altogether. Yeah.
yeah. And let me say that there is absolutely no judgment from my part, my patients. I'm not there to judge them. I am there to support them. So
Yeah.
if I know that someone is having alcohol once a week because they need it to cope, because they have a job that they go to events and it's important for them because they want to. I make sure that they take antioxidants before they drink alcohol and after they drink alcohol in the form of vitamin E, vitamin C, NAC. Make sure that they have a good curcumin supplement afterwards as well to ensure that the damage that that alcohol can cause in the body is minimized. So I
Mm.
meet my patients wherever they need to, wherever they are. But I always ask for a bit of a reduction in order to improve outcomes. So with the alcohol is very clear. And with antibiotics, you just mentioned before, antibiotics are very necessary sometimes.
Yeah.
If you have an infection, it's worth to keep the infection on than
Like risk
not taking the
versus benefit,
antibiotic.
right?
Yeah.
Mm.
So when they are needed, they're absolutely the best thing you can take to resolve an infection. But we know that we have a over prescription of antibiotics in these days. So only when needed. That's what I would say.
Yeah, but the research is pretty clear on alcohol, right, and its impact. We know,
And
yeah.
impact on everything. I mean, on everything. And
Yes,
not
I know.
just
I just think of intestinal permeability. It's just a no.
just
Ideally,
think.
a no.
I was reading an article about the effect that just one glass of alcohol of a standard alcoholic drink has on your sleep cycle. Now, if you
Mm,
draw the line between a sleep cycle and hormones and reproductive health, like it is like, we're very good at these naturopaths. It is very holistic, right? So it definitely has an effect.
mm,
But sometimes also having a couple of glasses of wine and socializing with your friends can be also very therapeutic. I know that I
absolutely.
do it myself
Yeah,
and it
me
feels really
too.
good afterwards. So I try to give the information to my patients and then they need to take it and apply it to their life. But there is absolutely no judgment.
Oh, absolutely. But I think sometimes also you just need someone else, like a practitioner, to we're laid out there on the line. I've had that with myself, with my naturopath saying, "Oh, rosacea started to come up this year. You've always had kind of good skin. Maybe we can drop the dairy for a little bit and other things." Where I was like holding on for dear life for that to have that cream in my coffee. So sometimes it just needs someone else, even though you know what to do, to say, let's give it a go for 3 months,
Mhm.
to go, I'm ready, I'm done suffering, or whatever it might be. Let's just try it. Um, so I'm conscious of time, and there's a few more questions that I want to go through. What do you encounter when trying to get male partners engaged in the fertility process? Like, what are the common barriers for them? Like, how do you address it with them?
Yeah, I think that they, in many cases, there is this fear that if my semen result come back negative or poor, I am broken. I am not enough of a person. I am not enough for my partner. I am less. And what I tell them from moment number one is this is just a baseline. We are not looking for a wrong answer. We're not looking for a problem. We're looking for the solution. Because if we find something that is not where we want it to be, we have a lot of power into changing that. And
Mm.
I think that goes back to the beginning of our conversation, and is that the testosterone, testicular function, and spermatogenesis are very dynamic. If you make the changes that I will tell you to do, your sperm will get better
Mm.
in most cases.
Yeah.
That is the rare outlier. Um, and once they know that, once they understand that they have so much power that they're like, oh, I am in control. So if I do this, I can change my outcomes. There is a much higher chance for them to get involved, motivated, and participating in all this fertility journey process.
Mm. How do you, because I'm assuming that, and again, it's an assumption, but I'm assuming that often you might get the female coming in to work with you on her fertility journey. Do you then bring it up with the partner? Do you, how do you approach getting the partner involved to
Mm.
that counterpart, the person, the female?
Yeah, I always send ask for the semen results.
Yeah.
And then once I see the semen results, if I see that in some cases I don't need to see the male counterpart because
Yeah.
they might have done a semen analysis. It's fantastic, it's looking great, and they know that the barrier for fertility is more in the female counterpart. So then I work only with the female counterpart.
So you've ruled out that.
Because we rule it out. So I have patients that I've never seen the male counterpart and I don't need to. Okay.
Yeah.
But in many instances, what in most cases is I always ask for the semen analysis. And if it's not what I want it to be, it's like, okay, your partner needs to make an appointment. Or if the partner is already there, I say, okay, I need to see you separate. Or can we do this blood test to understand? It's not always the same answer. It's a case to case base. But
Mm.
the first step is just getting the semen analysis with all the markers, and then you take it from there.
Mm. And this might seem like a bit of an ignorant question, but how often do you see optimal levels of DNA fragmentation, or what's the ratio? Like, do you see a lot more optimal levels versus fragmented, or levels that are in a place that you don't want it to be? Or is that very skewed because of the people that are coming to see you that need support with their fertility?
Mm.
Um, I'd love to hear what you clinically see when it comes to, do you often see semen analysis and DNA fragmentations that are great that you could just go, fantastic, we can rule that out? Like, what is it? What's your experience?
I see super semen, what I call a super
Super
semen.
semen.
Super semen, yeah.
Do you
Semen
tell the
that,
person that they have super semen? I'm sure that,
of course, they love to hear it. Why
right?
would
I
I
would,
tell them?
yes, I'd imagine.
Uh, and I tell them the truth. It's clear
Yeah.
from these results that you take an excellent care of yourself. So just
Mm.
keep going, please, because there is nothing that we need to do. Oh, and that can be one of the things. The other thing, and the other completely different side of the equation is your DNA fragmentation is at 70%.
Mm.
what is happening. In many cases, I have to say that when the semen DNA fragmentation has been at that level, it's also related with age,
Yeah.
with paternal age above 55 years of age, which I have seen in the past, wanting to become parents at that age. The DNA fragmentation goes high very quickly, especially after 55, after 50.
Yeah.
That has happened as well. But what I get a lot is it's somewhere in the middle. I would say lots of like 25, 35,
Yeah.
20, and then it's all about bringing it back to that level of below 10 that is the most desirable one.
Speaking of age, is there a cutoff for you? And again, case by case, I'm sure, but is there an age for a male that you're like, oof, the chances are, because I know with a lot of females, I had my children later. I'm 47. I had my last child at 45.
Hmm.
But there's a lot of practitioners might go, I can work with you if you're 45, or if you're really at a biologically healthy place, and that I feel like we've got a good chance for you to fall pregnant. Um, is there that kind of cutoff, for want of a better way of saying it, with males that you might go, 65, 70? I don't know if we should even be going down that route. What's what's your take on age for men, or is there just no barrier to entry for men when it comes to age?
I have had a few of those cases in which I knew that the chances of live birth were very low with
Yeah.
that sperm or with that egg.
Mm.
Um, and I have and I have told them that information. You're nice and gentle, and you explain to them, look, it's not that it cannot happen, it could happen, but every day that is going by, the chances are getting lower because of the age factor. And we can see this in these blood test results, and this is why it's not happening for you. Can we still work together? We can definitely work together, but your best option is donation, whether it is a sperm
Yeah.
donor or an egg donor, and then I point them in the right direction to what sperm donor programs are there or what egg donor programs are there that there might be more suitable for their needs.
Yeah.
Um, some people are more inclined to say, yeah, I don't mind. I just want to have a child. I don't mind to go with a sperm donor. And some other patients, they say, no, that's not an option for us.
Mm.
But I think answering your question, we need to be honest with our patients
Yeah.
and tell them realistically if their chances are very slim, and give them the options that will increase their chances. So if having an egg donor and a sperm donor is going to bring you from statistically from a 5% to a 60%, I need to tell you that. It's my responsibility to tell you
Absolutely.
that. And then you can make the decision because it's your life. So I definitely bring those conversations to my practice and to my consultations when I think that they're necessary.
Yeah. And which is why, obviously in your clinic and many of the fertility clinics out there, the measurements, the data is so important for everyone to see where everyone is at. So you
Mhm.
could, and also obviously there's a reality to it. That's the only time I thought of my age, actually, when I was trying to fall pregnant, because you then start to think about how long do I have before the chances are very, very slim. And,
Mhm.
my um, biological age might look very different to someone that is 47, but it may
Mhm.
not. So it's just important to kind of get the data so you know what you're working with, and then just have those conversations. I am conscious of time. There's one thing I wanted to mention, and it's about your book. So, there's so many things. Do you have time for one more question?
Of course, of course.
Okay. So, if you could change one thing about the medical system approaches how the medical system approaches male fertility, what would it be, and what would be the biggest difference for couples? Also, throw in there what your goal is for the male factor book that you've authored, and you've mentioned it briefly as well, but
Yeah.
I'd love for us to get into that a little bit more.
Well, we'll start with the book part. So, The Male Factor is a book that it is for any medical practitioner that wants a bit more information about male factor, but also obviously the book is written for patients, so it's very easy to understand. It has some scientific language, but I have tried to make it very digestible for anyone. I have put case of studies, I have put information about supplementation, about diet, exercise, and how all that affects sperm health. The book is gonna get released at the end of this month, the 28th of February.
Amazing.
And we are offering at the moment a 30% discount for anyone who purchases before the release day.
Pre-purchase?
Yeah,
Great.
like a pre-sale discount. And that can be found in rhreproductivehealth.com/bookstore. And I will send you that link so you can,
Perfect. Pop it in the show notes.
yeah. And what I'm hoping from the book is to bring a bit more light and a bit more knowledge for all those as are male at birth, that their their importance cannot be underestimated, and we need to investigate, and we need to treat when it is necessary.
Mm.
Um, the chances of success for natural conception or for any IVF related treatment, when both sides of the equation are taken into consideration, it's much higher,
Yeah.
much higher. So I'm hoping that couples are more empowered, that that they have more options, and there is less emotional, physical, and financial strain in couples trying to conceive. So I'm hoping for more equality when it comes to reproductive health.
Mm.
Um, and the you asked me a question as well regarding like what I would like to see change in this fertility realm world that we live in is appropriate testing. I will say
Mm.
that like for males and for females, I don't think it's okay to go to so much to get anyone to go through a very invasive procedure when appropriate testing hasn't been done.
I agree.
Like you don't know what your estrogen level are, you don't know whether you are ovulating or not, and this has happened to many of my patients in the past, and I think this needs to change. I don't know if it's from a medical perspective, from a law perspective, or some more information that needs to be brought to the medical community, but I think appropriate testing prior any treatment will bring a lot of peace for a lot of couples.
Mm. I agree. And is there anything else that you'd like to say that
But it
we
was a
haven't?
pleasure meeting you.
Nice to meet you too. I feel like there's a lot of questions we left on the table, but that's okay. I'll just have to get you back.
Yeah, we can hang out another time and answer a few other questions. And if any of your listeners have any questions, they can let you know and we can talk about them next time.
Beautiful. And thanks for all the work that you do. I'm excited that your book's coming out in a couple of weeks. I'll make sure that I make this live ASAP so people can get their hands on it at 30% discount, which is
Yeah.
awesome. Um, so yeah, thank you for spending your time with me today. I really appreciate you sharing your pearls.
Thank you so much. It's been great connecting with you.
And guys, if you have enjoyed this conversation or you know someone in your life that needs to hear it, please make sure you share this episode with them so they can fill up on the valuable content that Raul Pastrana, I'm sad that that's the last time I'm going to say that, well, maybe not, has presented to us today.